friends. Hi, this is Dr. Tirth Gill. I wanted to talk to you today about a condition called social anxiety disorder. It has also been called social phobia in the past. Under the DSM-5, the condition was renamed such, social anxiety disorder. So what is this? So a social anxiety disorder or social phobia is the fear of being scrutinized and judged negatively by other people in your social sphere. So it may be, person may be worried about how they sound, how they behave, and whether they'll be able to perform whatever is expected of them in a social setting. There's the generalized subtype and a performance subtype. In a performance subtype, the person is worried about performing in like a public setting, like a theater or a speech or something of that nature, that they will mess it up or their performance will not be up to the expectations of their audience, and that they will be judged negatively. That's what social anxiety is. Usually the duration has to be for 6 months, and it should interfere, like in order to be classified as a disorder, it should interfere with the social and occupational functioning to some extent. And then it should not be caused by a medical condition or any medication that the patient may be on. So how do you approach this? How do you approach treatment for this? First of all, the basic rule for any mental illness should be to rule out any medical causes that may be contributing to the anxiety or any medications changes that may be elementary. So look at that. It's worth going over those things. Also, you want to look at any recent stressors to make sure that it's not a reaction to something that has occurred in the recent past. Certainly people do get traumatized from occasionally having a bad social interaction, but it should not generalize and it should not persist. People get over those things. But if it persists, then it is a disorder. The good news is that treatment is available. So you can refer the patient for therapy, individual therapy, and there are some valid medication options available as well. So in regards to the therapy, you can use psychodynamic therapy, interpersonal therapy, but therapy that seems to have the most benefit is cognitive behavioral therapy. And we have to remember that there's a cognitive part and there's a behavioral part. The cognitive part in this situation would be for the therapist to clarify any distortion that may be occurring around the expectation that the individual has. They may have unrealistic expectations, and definitely, you're never going to be perfect no matter what you do. So if they're perfectionistic in their attitude, it may amp up their anxiety about social performance. So that's the cognitive part. You correct any distortions. When they overvalue ideas, such as the judgment of others, or they discount anything positive that they may have done in the past that was successful. So you correct those distortions, and then you come to the therapy, the behavioral part of the therapy. And in this, it can be fun. You actually have them, reenact scenarios where anxiety is bound to occur. You can do this in the imagination first, and then you can do it in real life as well. And you can get them sort of desensitized to that human interaction of being in a situation where they didn't perform that well, but hey, they're still standing, and you let them experience the fact that not being perfect is okay as well. In regards to medications for social anxiety, there are some good choices. Traditionally, phenelzine was there. It does work, but it's a MOI inhibitor, and for the non-physician, this set of medications is difficult to use because it has severe interactions with SSRIs and other serotonergic or noradrenergic, like any kind of stimulant medication, any kind of medication that kicks up serotonin. You cannot combine that with MOI inhibitors such as phenelzine. So that's off the table unless it's a really, really refractory case. The FDA-approved medication, paroxetine or Paxil, works very well. You have to use a dose 20 to 50 milligrams. Usually around 30 milligrams is able to help most people. And you can, see it when they present, when they return. And they will have a smile and they will tell you that they're interacting more. And it's a situation where there's added return every time they have a successful interaction. It emboldens them. It gives them more confidence. So that's a good thing. Other SSRIs also work. SNRI, venlafaxine also is supposed to be helpful. You have to go up in the dose. The main side effects with venlafaxine may be nausea. There may be nausea, GI distress. There may be mild elevation of blood pressure. So if somebody is hypertensive, you want to especially keep a watch on that. With paroxetine or Paxil, there may be some mild sedation, and any of these meds can have GI distress in the beginning. They both have a withdrawal syndrome also. So once they're better and you decide that you want to maybe taper them down, or they decide they want to come off the meds, the medications that we tapered down. Otherwise, there's a discontinuation syndrome with both paroxetine and venlafaxine. And it can be annoying. They may have flu-like features and anxiety. So it's important to do the withdrawal at a slow pace. So those two medications, the paroxetine, venlafaxine, which is Effexor, or any of the other SSRIs will work. Combine that with cognitive behavioral therapy, exercises to correct their distortions, that can also help. There are some other unique things that people have done and they still do. One is reinforcing the behavior in which the patient does not automatically focus on the worst possible outcome. So you have them, give them a scenario, and then you have pictures of people smiling or frowning and or neutral, and you train them, you reward them for choosing the neutral or positive picture first, because in the cognitive schema of the person with social anxiety, they immediately go to a negative perception, and you have to train them that to go with a neutral or positive expectation, and so it becomes a self-fulfilling prophecy that way. They think it's rooted, the tendency to go for negative perceptions of a situation is basically, again, linked to a survival instinct where you had to, focus in on what was not working. If there was any discontent, any disapproval in your environment, it was important in a small group that didn't happen. Your survival may have depended on it. But in this day and age, that you can't, first of all, please everybody. Second of all, nobody's perfect. And third of all, who's anybody to judge anyone? And you have to empower them, and then offer them these cognitive behavioral therapy, SSRI or SNRI, and you can refer them for group therapy also. That works very well. This is a set of over 12 weeks, a weekly group therapy with 6 to 12 patients. And it's usually two therapists, and they facilitate interactions. And the duration of the group is like 2 hours, 2.5 hours, so they get plenty of exposure. So there's a built-in desensitization in that type of therapy. So anyway, that's a little bit about social anxiety disorder and what you can do about it. Okay, take care. I'll see you next time. Bye. For the performance anxiety subtype, a beta blocker such as Inderal or Pindolol or any of the beta blockers that slow the heart rate down can be helpful. The person doesn't feel their heart, pounding, in their chest, and they become less self-conscious, and it improves their performance. The tremors of the hands, sweating, all of those things caused by autonomic arousal, caused by anxiety, are diminished with the beta blocker. So that's a simple intervention that can be provided. It's better to have that tested out first. Have them take the medicine in a stressful situation to see how they will actually react. It shouldn't be given the first time that they're going on stage or something. Thank you.